Guys, and welcome back to my channel. If you're new to my channel, you're more than welcome. I upload video every week. Consistency is key. So if you're new, you're more than welcome because this is yet to be your home. Welcome. And guys, if you are new to this channel, you're more than welcome, and do not forget to turn on the notification bell, of course, on the red button to subscribe to this channel. And of course, yeah, we're going to be talking about a lot of medical stories this year. I upload a video every week for those of you who are new to my channel. And basically today I'm going to be talking about medical issues. Yes, this I do not normally hold it here, but I have one home and one in the hospital, guys. Yeah, so this is for the house. Okay, so I'm an obstetrician and a gynecologist. That's my field, and I've been receiving a lot of complaints, especially this week, a lot of cases. So I just decided, why not share this with the ladies out there, since I'm in this field. Yes, and guess what? Today we are talking about, guys, we are talking about menstrual cramps and the pain. I mean, the girls go into their periods every month, and definitely we have some kind of pain. Now, is it normal to have this pain? What do you think? Why do you think? Is it normal to have menstrual pain? Let's come back. So most of the ladies receive this pain, including myself. I sometimes experience this situation. Yes, it is normal, yes, but on a certain level. Though sometimes people or ladies get severe pains that even they can't sit, they can't stand, they get vomiting, and all the symptoms. Yes, definitely, if the pain is more than bearable, then absolutely this is not normal. However, the pain has to be there. Why? Because your uterus is contracting. So definitely some muscles are relaxing and contracting, and definitely you have to feel a little bit uncomfortability than your normal days. Yeah, it's absolutely allowed. Though the severe pain, this is now where the problem comes now. Some people have been asking me, or this pain, I can't eat, I'm vomiting. So symptoms like that, you have to pay attention to them. Why should we say that you have to pay attention to them? By the way, menstrual cramp pain or menstrual pain, in medically it is called dysmenorrhea. This is the term that, of course, we use. So basically, this pain may start 1 to 2 days before your periods, and then maybe the onset of your periods, the pain become more intense. Yes, it is normal, but if it is severe, okay, maybe every time it is worsening, every month you're seeing something new, then you need to seek medical attention. Now, when you go to seek the medical attention, what may cause these pains? Yes, so this pain may be caused by a number of things. Remember, I told you it's normal, though excessive or severe, it's not normal. Yes, so in case it is very severe, then definitely it's severe this month, next month is worse than the last month, the other month, then definitely you need to come to a gynecologist and of course do some checkups. Now, what causes this pain? There are a few factors. Sometimes it can be, maybe you have endometriosis. I will write you shortly what that means. Endometriosis, basically in this time, the outside of your uterus is going to grow. There are some cells that grow, so they're going to grow outside your uterus instead of inside your uterus. So this is endometriosis. Sometimes people have what we call fibroids, which a lot of you guys have heard about. And of course, sometimes it's not your fault to have fibroids. Something just grows where it is not supposed to grow. We call them uterine fibroids. Mostly they occur in the uterus. So in the process of your menstruation, contraction, they are just pressing the walls. At the same time, they have to press these big fibers. Definitely you have that pain. And of course, we have something which is may not be known for everyone. It is called the adenomyosis. Basically, sometimes you find that in some ladies, the uterus has, of course, its lining like any other tissue, and definitely this tissue is going to grow into muscles. So for you to contract a muscle during your periods, definitely it's going to be painful. And I will not go into details of everything I'm saying here, guys, but of course, if you want me to talk about more about these things, comment below, and of course I will take it from there, guys. Also, the very common reason for this pain, it's what we call the PID. Now, what is PID? Pelvic inflammatory diseases. Now, these ones mostly they are sexually transmitted diseases. Now, guys, quote me correct, it's not HIV like most of you think so. Of course, it's one of them, but we have what we call touch diseases in the gynecological field, which I will not go into detail. Things like chlamydia, things like in the past maybe you had a chlamydia infection, or maybe your partner had gonorrhea and you acquired it, and so many other diseases that fall under this category. You will start to have this pain because you were lady. You will have it faster than your partner, and definitely as it keeps growing and growing, the infection circulates under your of course your fallopian tubes. Okay, so I'll project that picture over there of the female reproductive system, because once you have these PID diseases, what happens is that mostly, especially what we call chlamydia, it's going to circulate into these tubes. Now, what happens is, in case you get pregnant, this is where you hear about ectopic pregnancies and so on and so forth. Yes, so the other last cause, it could be the cervical stenosis. Now, what does this mean, guys? So now, some morphologically or structurally, some ladies may have small opening of the cervix. It's not their problem. That's how God created them. And definitely when this, this monthly shedding, the periods come, the pressure may be too much, and it, the small opening may not be able to take in all down that blood, and definitely you'll feel pain. Yes, so for you, if you have this severe, very, very severe pain, definitely go and check with your doctor what may be the problem before it is too late for you. Okay. They may recommend you, of course, to do the ultrasound, normal ultrasound, to see what exactly is going on with your inside your uterus. Sometimes they can also do the vaginography, where they pass something under your vagina to check if all your walls and everything is good. And also they may recommend the MRI, because the MRI is going to pull out all the information that maybe the ultrasound didn't see. And maybe in worst scenarios, you can have the laparoscopy, whereby at least they may get some samples of the layers of your uterus to check if there is something wrong or cancerous process. It all depends on your doctor. Now, how can you treat this? Well, first of all, I should say that a treatment, it will all depend on your doctor, definitely, depending on the situation that they find out. And of course, first things first, we still think about painkillers like paracetamol, ibuprofen, diclofenac, to kill the pain. Yes, and of course your doctor may recommend you to start your hormonal birth control. Now, people think that contraception is just to control you from getting pregnant. This is not correct. It is one of the functions, the main function. However, also some people lack down some hormones, so to balance up these hormones, we recommend the birth control pills, yes, that can be taken orally, or some other methods can be used. And of course, while you're taking this contraception, of course they will of course control your ovulation, so that you will not have this pain of menstruation. And of course, in worst scenarios, if the situation like endometriosis, big fibroids and all that, surgeries may be recommended, and based on your situation still, they will find the suitable surgery that they can do for you. Yes, guys. And on the other hand, there are some things you can do at home to reduce this pain, like I said. Usually people think people who go to the gym, people who exercise is just for looking good. No. So if you exercise, some people are obese in a way, maybe not physically, but inside. Yeah, it's not only about the physical but also the outside. So to reduce this cholesterol amount, the fat amount, you have to exercise a little bit, so that your muscles can get used to a little bit contraction, so that period, is not so much. And also use of heat, guys. For some of you guys have not seen this, we have this hot water bottle. You can fill it with water inside, and of course water will be inside hot, and you can wrap it in a towel and you press it on your on your tummy or your abdominal part. It can also help to reduce the pain. You can buy it, or you can soak some towel in water and press it on your stomach. Also, your diet, you can take in dietary supplements before your periods, actually. And of course, like omega-3, and of course some vitamin supplements, so that your immune system is in good mood, you know what I mean. And also, on the other hand, what I recommend is that before maybe 2 days or 3 days prior to your periods, you feel this pain, so you can take these painkillers before even you see your period, so that at the end of the day the contraction movement is also under control. And also, the other last point is that, guys, we have to reduce the stress, because if you stress, you're not only stressing your reproductive system or something like that, it's mentally. So basically, all this pain hormones are going to be released. So that marks the end of the video, guys. I just wanted to talk about this menstrual period pain, or this menstrual cramps, or dysmenorrhea. So if you found this very useful, of course give it a thumbs up, share my content. If you want me to talk about medical videos more often, guys, I will do that. All you need to do is to subscribe, leave your comments below, why not, and we will talk about it. And once again, this has been my day out today. I just wanted to help someone there, and I hope you find it useful. Until then, see you in my next video. Peace.